Taken live, sir.
Okay, sir. Ma'am, we are starting, madam.
Okay.
Okay, so very good evening, doctors. I am Dr. Stalin on behalf of Shield Healthcare, welcoming you all for today's webinar. The topic for today's webinar is breastfeeding in COVID-19 pandemic. I welcome all the participants. I request them to post their queries for our speakers so that we can have a short Q&A session at the end of this presentation. And now it's time to introduce our invited speaker for the day, Professor Dr. Sampath Kumari, ma'am. Madam is currently the Chief and HOD Department of OG, Muthukumar Medical College and Research Institute, Chennai. Madam is the Foxy Vice President Elect 2022, Chairperson Foxy Adolescent Health Committee 2016-18, and Deputy Director and Professor of OG Department, retired, and Institute of Obstetrics and Gynecology, Madras Medical College. Madam is also the President, Board of Studies, OG, TNMGR Medical College, Medical University, and member Board of Studies, OG Meenakshi Medical University, and ICOG Governing Council member 2015-2020. So Madam has received the IMA Doctors Award from IMA TN State Branch, Foxy, Dr. Durusha Distinguished Community Service Award, Foxy, Mr. N.A. Pandit and Mrs. Shailaja Pandit Women's Empowerment Award, and Karmavir Chakra 15 National Award for Adolescent Activities from ICUOGN. Madam has also authored the textbooks in Foxy Focus and newsletters. So with this short introduction, I welcome you, ma'am, and I hand over the session to you for further proceedings, ma'am. Thank you, ma'am.
Thank you, Dr. Stalin, for the nice words. I will open my. Stalin, is it visible?
No, ma'am.
Not visible.
No, ma'am.
What happened? Oh, share screen porama pottana. Okay, very good.
Yes, ma'am. Now it's visible, ma'am.
Yes. First of all, I thank the Shield for giving me the opportunity, and thank Dr. Stalin for the nice topic. See, dear viewers, all of you must be aware that August 1st to 7th, we are conducting that breastfeeding week. Why it is conducted in August 1st to 7th as a breastfeeding week? First, by the World Alliance of Breastfeeding Action. They only considered this in 1990. This breastfeeding awareness week is mainly to encourage breastfeeding for the mothers and to spread the message of benefits of breastfeeding to everyone. So this is the why they have taken that August 1st to 7th as the breast week. Now we will see what is the importance of breastfeeding, and then we can go to what happens in the COVID. Whether we can feed or we should not feed, everything we can see. See, as all of us know, the breastfeeding, it is very, very important. It is only the feeding for the baby for the first 6 months. It gives nutrition, development, and maternal health. Maternal health, it is given. The WHO recommends the exclusive breastfeeding for the first 6 months of life. That is, when the baby is born, for the first 6 months, we have exclusively, we should feed the baby only with the mother's milk. After that, you can continue with other complementary foods for 2 years. And during this period, the baby will have the skin-to-skin contact. So only we used to tell, whenever the patient is an antenatal itself, the Gangaru care of the mother. Once the baby is delivered, sometimes if the mother is going for a PPH also, we make the baby lie on her abdomen. So if the baby is going to suck, the next minute, the bleeding will stop. One of the methods for breastfeeding will also be the treatment for postpartum hemorrhage also. So the Gangaru care is very, very useful in case of preterm babies. So that is the way where the baby and the mother will have the bonding and the skin-to-skin contact. What the WHO and UNICEF tells, as I told earlier, exclusively breastfeeding for 6 months. What it includes, previously our old people they used to tell, the first few drops of milk you should not give, that you have to press it, and then after that only you have to start giving the baby the milk. It's not like that. The first hour of life, that is the first hour, whatever the secretion comes, it is the colostrum. That is very, very important. So initiation of the breastfeeding is within the first hour. Whether it is normal delivery, even in the section LSCS cases also, if they are comfortable, they can start feeding within 1 hour or within 2 hours. This breastfeeding, we tell that we should give only the breast milk for 6 months. Even the pediatricians, they advise, don't give any or even water. It should not be given. Only whenever the amount, whatever you give, how many times you give, it is not at all a matter. But the first 6 months, you have to give exclusively the breast mother's milk only. And when it should be given, there is no restricted time that you should give by 1 o'clock, you should give by 2 o'clock, you should give by 3 o'clock. It is not at all that. Nowadays, even in the government setup, they have the maternity leave for 9 months. They can be in the house after the delivery for 9 months. So the 9 months, whenever the baby is demand, the baby will definitely demand. If she is hungry, if she or he is hungry, baby will cry. Whenever the child wants, we have to feed the baby. It can be a day or night. So usually we tell the patients, whenever the baby is sleeping, you also go for a sleep. So don't consider that you have to feed only in the day, only in the night. Whenever the baby demands, you have to feed the baby. That is the rules, but no need for bottles or whatever it is, you should not give. Breastfeeding is the best feeding. As all of us know, it is very, very useful against infections, and the baby can be prevented from allergies and any chronic illness also. It is very, very useful. Most of the time, we have the complaints from the patients. Most of the time, the patients will tell, I don't get milk. It is not like that. Whether thin or obese, everyone will get the milk. The main problem, how it is stimulated is the infant suckling. Only the baby suckling effect will stimulate and will produce the milk. As long as the baby is suckling, the breast milk will be definitely present. When the baby sucks, the stimulation of the nerve endings in the mother's nipple and areola signals to the hypothalamus and the pituitary. From the pituitary, it is released the prolactin and oxytocin. All of us will know this mechanism. But still, the baby suckling is very, very, very important. That we have to counsel the mother. So this hormone will act on the bloodstream to the mammary gland and stimulate the milk production and ejection. So as long as the baby is suckling, the mother's milk will be present. So you should encourage the mother to make the baby suck the breast. So that is the suckling reflex is very, very important. What are all the compositions of this breast milk? As I told earlier, first few hours is colostrum. Then it is transitional milk. Then it is mature milk. What is colostrum? That is the early milk produced in the later stages of the pregnancy. Even in the later stages, some antenatal mother they will complain, I have a milky secretions or watery secretion from the milk. Then we should be very, very careful. If there is a secretion, means immediately they will be going for the terminations. So from the late stages of the pregnancy and for the first 4 days, whatever the milk is secreted, it is called as colostrum. This colostrum contains 7.5 grams of protein and 2 grams of fat, 4 to 5 grams of carbohydrate, and for 150 kilocalories, it is totally present. Then next, from the 4 to 10 days is present the transitional milk. It is called as transitional milk. It compared to the colostrum, the protein content will be less in this transitional milk. It is from 7.5 to 2.5, and fat is increased 3.2, carbohydrate is increased, and calories reduced 60 to 80. So the first few hours milk has the high protein. After that, it contains the fat. Then comes the mature milk as long as you feed. From the 10 days, as long as for 1 year or 2 years, until you feed, it will be present. In this, it will be contain the protein amount of 1.1 to 1.5 grams. And fat is again increased to 3.5 to 4.5 grams. Carbohydrates again increased to 7, and the calories are almost equal, 65 to 70. So in the first 4 days milk, protein is present in a high amount, and the next from after 4 days, the fat content is comparatively increased than the protein. So what is this milk? Milk secretions, we sell early milk and the late milk. What will happen? Sometimes the baby sucks only for 5 minutes, only for 10 minutes. It's not like that. So when the baby is suckling, that is the first milk which comes. It is mainly to fulfill the thirst of the baby. So the first milk, when it sucks, it contains more lactose, proteins, and water. So this water will satisfy the baby's thirst. Then the late milk, that is from the hind milk, that will contain richer in fat content. As I told, the first 4 days protein is content is increased, and after that fat is increased. Similarly, with the each feed, the early milk will contain increased amount of lactose and proteins, and the late milk will contain the fat content. So the early milk will satisfy the baby's thirst, and the late milk will satisfy the baby's hunger. So till the baby's hunger is satisfied, the baby will continuously suck. It may be for 10 minutes or it may be for 15 minutes. That suckling reflex is not uniform for all babies. Depending on the baby's immunity, they will have suck for 10 minutes or 15 minutes. This milk is, as I told, both fore and the hind milk is important for the growth of the baby. Not only the fore milk, not only the hind milk, both are important for the growth of the baby. And once the one side breast, it should be allowed to completely empty. Once the milk is not there, immediately the baby will cry. Then we can understand that this milk has been emptied. Then we have to go to the opposite milk if the baby is thirst, or if you are going to feed the baby the next time you should start from the right side. So alternatively, the first breast, if it is emptied only, you have to go for the second breast. And if it is emptied, again to the first. That all of us know. That has to be fulfilled. The breastfeed baby, this is the main endocrine system, reduces the incidence of diabetes in all system. It works. It increases the IQ also. And the mouth sucking reflex will be increased. Respiratory system, heart, cardiovascular system, and kidneys with less salt and less protein. Every system from head to body, it is very, very important. And the whole system is getting stimulated with the breastfeed. So it contains antibodies, hormones, antivirus, anti-allergies, anti-parasites, growth factors, enzymes, vitamins, and everything is present. And it is helpful in every system, from digestive system and bowel habits, joints, muscles. So breastfeed is the universal for the baby and everywhere. So if you are going to give the formula milk or animal milk, what happens? What is the difference? This everyone will be knowing, but still it is only a recollection. Why we are always tell that we should give only mother's milk, only mother's milk. Repeatedly, if you hear, you can counsel the patients to go for a mother's milk alone. This is human milk and animal milk and formula. As for the comparisons, the bacterial contaminants, it is none in the human milk, but here it is likely, and the formula milk, it is mixed. And the anti-infective factors and growth factors, it's present more in the human milk. And in the animal milk, it is not present. In the formula, it may be present, but it is not present. So the protein, as I told you earlier, it is easy to digest. And here it will be there, but it will be difficult for the baby to digest, too much difficult to digest, and it is partly corrected. Fat, again, it contains essential fatty acid, lipids, everything with the mother's milk. Normally, the baby, taking the mother's milk, the digestion problem will be very, very easy. If they are going for an animal milk or formula milk, again, the digestion problem will be difficult. Then they will complain the baby is not passing motion, and it is sometimes most of the babies, you can see the abdomen is full with a limited little amount of the milk itself. So iron content, this is well absorbed here. Here it is only small amount is absorbed. Here extra adding is needed. Vitamins and water, you have sufficient amount with the human milk compared to the animal milk and formula milk. This counseling has to be given to the mothers. That has to be given to the patient. This has to be started as soon as the mother is becoming, the patient is becoming pregnant. Nowadays, in most of the clinic, we have the antenatal counseling OP. During this counseling OP, we talk about that why is the breastfeeding is important, what are all the importance, how they should feed the baby, and how they should take care of the high-risk pregnancy also. So the antenatal clinic itself, we should chart, and we should try to examine the breast from the 7th month itself, whether the nipple is retracted inside or the nipple is in the normal position. If it is not, that small massaging can be done. So from 7th month itself, you should have a look on the breast itself. This is the same which I told earlier. That is with the comparative proteins. What happens with the human and the cow? So 35% casein only. Here it is 80% casein, which is difficult to digest. In the mother's milk, it is only 35% and it can be easily digested. Then if you compare the fat, what happens with the fat? It contains lipase and essential fatty acid. It contains no essential fatty acids, that the cow's milk and the formula milk. Because of this contains essential fatty acids and enzyme lipase, the digestion will be very, very easier. Whatever be the purpose, whether the fat or whether the protein or whether the vitamin, the digestion should be easy because the baby is very, very small, newly born. It is around 3 kg only. To make the digestion purpose easily, we have to counsel only the mother's milk. Coming to the vitamins, vitamin C, vitamin A, everything is increased with human milk. With the cow's milk, it is very minimal. So because of this vitamin, which is essential for the growth of the baby, the growth factors from this only they can get in. Then coming to the iron amount. Iron here it is 50 to 70 microgram in the human, whereas in the cows it is same thing, but in this the absorption will be only 10%. But with the human milk, it will be about 50%. So 50% of the iron will be absorbed, such that we no need to give an extra added iron. Nowadays, all of the babies, they give only the vitamin D3, no need for the iron. So what is the advantages? As all of us know, the breast milk, it is a perfect nutrient with needed amount of fat, needed amount of protein, needed amount of vitamins, and digestion is very, very easily digested and efficiently used. And it protects, again, as I mentioned, infection, and it is needed for the development of the bone mass, muscle mass, and everything for the development of the human milk. Very, very useful. And if you are going to, if they are the patients, if they are going to feed the baby for 1 year or 2 years, it is one of the method for contraception, lactational amenorrhea method, LAM method. So it also postpones the next pregnancy. So exclusively breastfeeding is done means there is no, definitely there is no chance of ovulation and there is no pregnancy, that in the first 6 months. And then there may be the delayed ovulation will be present. So this will postpone the next pregnancy and protects mother's health also. As all of us know, it can be free from the CFS. And cost wise, whether the cow's milk or the formula milk, the cost will be higher. For this, the mother's milk, wherever they go, they can feed. Where every time it is available, cost is also the mother has to, once whether they feed the baby or not, they have to have a good milk to recover from the pregnancy. All systems will be disturbed with the pregnancy, so that to come back to the normal situation, they have a good diet. So the cost wise, it is very, very less. So the artificial feeding is not advised, only the mother's milk. Still we are talking, even the educated women, they are not going for the mother's milk. They give only for 1 or 2 months and they just start stopping the mother's milk. So it has to be counseled repeatedly, not only in the month of August, every month, every day. It has to be counseled to the patients that mother's milk is important. What is the artificial feeding? The bonding. Nowadays, all of us, we know when they become adolescents, they don't have the bonding with the mother. So at least during the childhood, they should have, during the infancy, bonding. With the artificial feed, anyone can give the bottle feed. Not it doesn't mean that only the mother is going to give. Anyone. So the bonding is separated from the day itself. So to have the bonding, the mother's milk is important. And the digestion, it is not easily digestible. So they can go for diarrhea and repeated respiratory infection. The baby who is getting only the mother's milk, they will not have cold or cough immediately. But with the artificial feed, they will have the frequently the respiratory infections and the diarrhea. Sometimes it may be persistent also. Then the malnutrition, in future, marasmus and everything. This is the vitamin A deficiency. Sometimes this is very rare, but the deficiency is also reduced. The mortality with the artificial feed may, if they don't listen and if they are going to continuously give means, it may get aspirated also. More allergy, infections, overweight. With the, if you compare the babies of 100 babies taking the mother's feed and 100 babies taking the artificial feed, definitely overweight, obesity, morbid obesity will be there with the baby taking the artificial feed. That is definitely it is understood. So the overweight is because of the artificial feed, which contains the high fat content. The lowest goes the IQ. It will with the mother's milk, IQ will be definitely 2 to 3 points will be increased compared to the artificial milk. So the incidence of anemia, ovarian, breast cancer of a mother, the breast cancer, usually if you are going to feed the baby, whenever the patient comes with a history of breast cancer with a lump in the breast, the first thing we will ask is how many children and how long you fed the baby. If they have no children and if they have not fed the baby means, we take them as a high risk for breast cancer. So there is an increased risk of ovarian and breast cancer, and they may become pregnant soon and they will go for a termination and repeated abortions and everything. So the mother's feeding is breastfeeding will say is good for baby and as well as good for the mother. So what is the benefits? Which all of the benefits I have told, but still there are more than 8 lakh breastfeeding could have saved the lives of more than 8 lakhs to 20,000 children under the age of 5. If they are getting the mother's milk, definitely the mortality and morbidity, everything will be reduced. And IQ, as I told, it may increase to 3 to 4 points in the mother's milk compared to the artificial milk. And a lower infectious morbidity and mortality rate, everything is reduced with the mother's milk. This obesity, morbid obesity, overweight, everything is also reduced. This is the infant's benefit. As I told, the patient, the baby will not suffer from urinary tract infection, inflammatory bowel disease. In future, they may not have diabetes, gastroenteritis. These infectious disease and whatever pneumonia, virus infection, sepsis, sudden infant death syndrome, everything will be reduced with the mother's milk compared to the artificial milk. So it provides immunological protection while the infant's immune system is maturing. The antimicrobial agent, anti-inflammatory agent, and immunomodulating agent. So if you want your baby to be free from any disease, and if the baby to have a high immunity, the mother's milk is the only treatment for the baby. Then the benefits for mother, if they are going to breastfeeding is going to be continued exclusively for 6 months, and with the complementary food for 2 years, 20,000 women's death from the breast cancer. That is the commonest women's carcinoma in the women. That will be reduced. That to death, 20,000 death can be reduced if the breastfeeding is continued. You can reduce the mortality of 20,000 because of breast cancer in future. And it also improves the it is one of the method of contraception, as I told, lactational amenorrhea method. And the women's risk of obesity for the baby is also reduced. And obesity for the mother is also reduced, and the other CA is also getting increased. What it happens to the society? What is the benefits to the family? Money saves money. Sometimes they may not have it. They may, if it is the month end, if they are going to be a job means after 25th or 26th, 27 during the month last end period, they may not have money and they may not be able to get the artificial milk or whatever it is. So it saves the money and always it is present. And it promotes the family planning. So they can have the spacing between with one baby and the other baby. And the hospitalization, if the baby is going to get diarrhea means repeatedly, they will go for dehydration. Dehydration means they may end up with the fits also. So they have to go get admitted to the hospitalization. So the mother's milk will reduce the incidence of hospitalization, that is getting admitted in the child ward. It also getting reduced and the child survival is reduced. So as far as the family and society is concerned, money is saved, contraceptive method, hospitalization is reduced, and it contributes to the child's well-being. Survival will be very, very good. These are all the rules of breastfeeding. That is exclusive breastfeeding for 6 months. It is a must for all mother who is getting delivered, and all babies should get the breastfeed mother exclusive breastfeeding for 6 months. And it can be continued for 1 year or 2 years. We advise for 2 years, at least for 1 year they have to give. After 6 months, they can have the complementary foods, whichever suitable for the baby. And the complementary foods should be rich in the iron and the micronutrients. That should be started only after 6 months. Even water should not be given up to the 6th month. It is only the previously we used to give the grape water, bone is on. Nowadays, no pediatrician is advising to give anything because this breast milk itself has whatever is needed for digestion purpose and the vitamins and everything, water, thirsty, everything. So this complementary foods is not at all needed for the first 6 months, only the breastfeed. Sleep also, it will be facilitated by the breastfeeding. by hugging when you sleep. Usually we should tell the mother, don't feed the baby in the lying down posture. Mostly they should give only in the sitting posture. In the lying down posture, they may go to sleep and the baby will be awake, and sometimes they may go for the cot death like that. So they should feed the baby in the sitting posture only. So initiation of breast within 1 hour. In the normal delivery within 30 minutes, and in the LSES, it can be up to 2 hours also. So immediately within 1 hour, you can start the feeding. How many times feeding should be taken? There is no limitations. That is on the demand. But to take into account, you can give 8 to 12 feedings every 24 hours till 2 to 3 months, and 6 feeding till 6 months. That is first left side breast is empty, then the right side, whatever it is. First one side breast, one it is empty, then it go to if the baby is not hungry, is not fulfilled, go to the opposite side. So for 24 hours, you can for up to 3 months, 8 to 12 feeding, and 6 feeding till 6 months. And after that, depending on the complementary food, 5 feeding or 4 feeding, whatever it is. So it is better for first 6 months, not to go outside and feed the baby. If they go for official work within 3 months, there also we have methods to keep the stored the bill that I will be showing in the coming slides. What are all the rules of breastfeeding? At every feeding, infant is placed only one breast, and then during the next feeding, if it is emptied, you go to the alternate breast. So if suppose if you are going to feed the baby with the left side feed, and the baby is thirst and hungry is sufficient, and the baby is not going to suck on the right side, means after the next time when you are going to feed the baby, start from the right side. Some mothers, they have the habit of giving on the left side itself, and some other have the habit of giving on the right side itself. But alternately, it should be given. It can be given even for 20 to 30 minutes, minimum 15 minutes. If at all needed, the duration can be for 20 to 30 minutes also. So the exact time and exact amount, exact frequency, there is no rules and regulations. Depending on that, that is to have, if the baby is not continuously sleeping, means you should not leave. Some baby will be sleeping continuously for 3 hours, 4 hours. In that situation, we have to wake the baby and give the feeding. For that purpose only, I told us 8 to 12 feedings in the early months, and then 6 feedings at the later months. The amount of the milk, what is the amount? How it comes? It depends on the suckling reflex only. If the baby is going to suck frequently, that is 8 to 12 times or 15 times, whatever it is, the more suckling, there will be more milk secreted. The suckling is the hormonal mechanism which produces a prolactin, and which acts on the prolactin and syntocin acts on the mammary gland, and the milk is produced. So suckling is the reason. And again, the mechanism will be good. The mother will be always, sometimes they will be in the depressive mood, and they will be in the thinking of something else and feeling. So when they feed the baby, the mind should be free. The mind is depending on the mother's thoughts. The breast milk secretion will also get reduced. So whenever they feed the baby, they should be happy, and they should be free from the bad thoughts. So the babies, as I told, day and night, anytime, day and night, whenever the baby is crying, they have to feed the baby. And no supplements for 6 months. And after 6 months, if at all needed, whatever food, first you start with whatever you needed, small, semi-solid food, then solid food, that depending on the digestion possibility of the baby, it has to be solid. Then again, how are you going to feed the baby? The baby's mouth should be widely open. Then only it will catch the nipple, and it will be easier for the baby to suckle. Normally, we used to feed the baby, when you feed the baby, it will suck and your breast milk will come. But we should monitor how the baby is taking the feed, and we should ask our staff nurses to teach them how to feed the baby and what is the positions they should have, whether the baby is sucking the breast sufficiently, and the milk which is coming is sufficient. That is very, very important. Mouth should be wide open, and areola visible underneath the chin, then above the nipple. And the chin should be touching the breast, that is skin to skin contact. And lower rib rolled down, and nose is free. If this is the situation which they are feeding, there will be no pain for the baby and for the mother. Now we have a lot of counselors who come to the house and they themselves teach how to feed the baby, what are all the methods. And if you are not if you don't know how to feed, you can get the help of the counselor also. Now there are a lot of numbers. Now you have a lot of facilities, Google form, WhatsApp form, everything you can search and learn how to feed the baby. In the antenatal counseling classes itself, they will teach. If at all you have a doubt and if you are not able to feed, means you can get the help of the counselor. Indicators for successful feeding. What is that? The successful feeding means at least 12 times per day, 24 hours, it should be given. And the visible, audible and visible swallowing, the baby is swallowing should be visible. The baby is taking. Sometimes what will happen, the baby will keep the mouth wide open with the breast and it will not suck. So that has to be monitored, whether it is sucking sufficiently and whether the milk is going into the baby and whether baby is able to swallow. Everything has to be watched. And the regular soak, the heavy neffers. Sometimes if you are baby, we don't know whether the baby is taking the feeding or not. The patient may not be able to tell. In that situation, we can ask how many times the baby has urinated. So if he has not urinated, means there will be the mother would not have given sufficient feeding and the baby would not have given urinated sufficiently. So that history is also very, very important. And weight gain of the baby. If the baby is not gaining weight, means we can be very sure that the baby is not sucking or the mother is not feeding sufficiently. So the how many times the baby is urinating and what is the weight gain. So only every week they see the weight gain. If the baby is preterm or whatever it is, at least 20 to 40 grams per day will be the average weight should be there. Then only we can be sure that the baby is having the sufficient feed. And sleeping and comfort, everything we have to ask that. If the mother is giving the feeding correctly and the baby is suckling, means from the mother also we can see the breast will be soft. Sometimes we can see the left side breast will be normal and the right side breast will be hard. Sometimes it will be a warmth and we can see some, most of the time some patients will also complain. We feel like a lump or hardness where the milk will be getting secreted, where we advise for warmthness and express the milk, and after that we will ask the mother to give the baby. So if the breast is softened, means we can be very sure that they are both the side breast. It will be compared. Always see the left and right, whether equally soft or they are giving in the one side or both the side. No compression of the nipple at the end of the feed and woman feels relaxed and sleepy. If the correct method is followed and the correct amount is given, the baby is also comfortable and the mother is also comfortable. Sometimes the baby will not take the feed and mother will have more amount of the milk, and in that time also they will be having pain. In that cases, if the baby is not taking, we can ask them to pump and store it in a container. The rules of the breastfeeding, it evaluates the hydration and it evaluates the body weight and assesses the feeding and consider the frequent follow-up and maternal and infant issues. Anything is present and observe the feeding. This is very, very important. Even though we are giving the breastfeeding, only breastfed baby also, nowadays we should give 400 international units of oral vitamin D drops after beginning from the second month of the life. So it is better vitamin D to be given to all babies, 400 international units. As all of us know, vitamin K is given immediately after delivery within 6 hours. So vitamin K and vitamin D is essential and it should be continuous. So as I told, if they are going for job, that it is compulsory, they have to go for a job, means in that cases, they can keep the breast milk in the container. But still, first 6 months, you exclusively be in the house and feed the baby. The human milk, what is the storage mechanism? Can be stored at the room temperature for 6 to 8 hours. And with the ice pack, it can be stored for 24 hours. And breast milk can be stored in the refrigeration, 40°F for 5 days. And the freezer compartment up to 2 weeks with the 0 to 5°F. So this is the deep freezer, which is kept for 3 to 12 months. So if it is any necessary, if they want to go to the office or whatever work, in that cases, we can ask them to keep container 1, container 2, container 3, and where it has to be, it can be kept with the ice box and a refrigerator and the freezer, wherever it is possible. Sometimes they can give it as 1 and 2, and they ask the attenders to feed the baby. Repeatedly, I will tell, till 6 months, they should not go for any official work. If it is an emergency, they can store the breast milk, and it should be given exclusively for up to 6 months to the baby. So what is the barriers? Why the people are not giving breastfeeding in spite of repeated counseling, in spite of repeated breastfeeding week? They adequate knowledge. The antenatal counseling class is taken, and you see from the media and everything. Again, the social negative perception. Some feel that if you are going to give the baby, their beauty will be lost. Some wrong information is still going on, but it is not like that. So the individual aspects has to be change, and the support from the partner and the family. Somebody has to look after, somebody has to financially support, then only they can be in the house and perceive threat to father-child bond is also very, very important. And the institutional return to work within 3 weeks, within 3 months, and lack of workplace facilities. If there are sometimes in some official places, they have places for the baby also, but they may not be having the workplace facility in some office. In that cases, they may not be able to feed institutional unsupportive healthcare environments. And community discomfort in the public when they are going the bus, when they may not be able to see there somebody, she may not be comfortable for feeding the baby will be crying and she is not comfortable to feed the baby. In that case, they will go for a bottle feed baby. In that situation also, what we can do, we can press it from express from the house itself and take it in the container. And mostly you should not go out. If at all you go, you can take it in the container and it can be used in the bus also. The policy is aggressive formula ad. You can take many ad. This formula can be artificial formula is useful for birth. This artificial formula is having good IQ. This will growth. So because of the ad from the media, that is also the one of the reasons. So the barrier is from the individual and from the lack of support from the family and working places. If they want to go for work for an emergency or whatever it is, and the discomfort and the ad media. These are all the barriers. And the contraindication, there is no contraindications and all. But infants with galactosemia, some and ketonuria babies, some babies, sometimes they will have, as soon as they take the breastfeed, they will go for diarrhea and something will be that. That is the galactosemia. It's under conditions, there is no other way. We have to go for alternative. And the mothers taking some other tablets and the radioactive isotopes, chemotherapy agents. These are all the only tablets, antimetabolites they are taking. Other than that, no indications, no chronic disease is a contraindication, including our COVID. We will come to the COVID pandemic in the later. First, we will see this. So these are all the mistaken. Whether if I have a LS, yes, I can feed the baby. Definitely the answer is yes, you can feed the baby. Whether the baby is vaccinated and whether they can go for the breastfeed. Definitely the answer is yes. Whatever I have undergone breast surgery long back, now whether I can feed the baby. These are all the myths which the patients are still having. No LSES, whether the baby is vaccinated also, and whether baby is suffering from fever and you have undergone any breast surgery, whatever vaccinations, who have hepatitis A, B, C, whatever it is, you can give the infants. A breastfeeding is must. So the baby will be receiving the immunoglobulin, suchever is needed for A, B, C, and then you can go with the breastfeeding. So breastfeeding is not to be stopped at any indications except for the galactosemia. This is again the mother's milk and the formula milk. 3 days old baby, where baby is no different than this way. 3 days old baby getting the mother's milk and 3-month old baby getting the formula milk will be equal, the strength. So the mother's milk has the high strength and it is the very, very important, and it is for the mother's milk. These are all the positions which you can, cradle positions and cross cradle position, football hold, laid back position, side laying, but you should not give the feed the baby in the lying position itself. This side laying is advisable. This only I told, if you are not comfortable in feeding, you can get the help of the counselors or you can get the help of the staff nurses. Even the twins baby, in that cases, football hold for 2 twins. One baby on one side and the other baby on the other side. Say the same at the cradle hold. This pictures I mentioned only for the twins baby. Even in the lying down with the 2 twins, they can feed with the slanting positions. both the babies can be fed. Even in the twins baby also, you should have a good diet, and both the babies should be satisfactory. If you have a good diet, you can have a sufficient milk for both the babies. These are all the things you should counsel for all mothers. Whatever I have told, it should be counseled during the antenatal mother. Now we have the BPNL group, I Decide group. There are a lot of NGOs which they are focusing on the breastfeeding itself, and they conduct classes in every nursing homes also. What happens to this pandemic? Whether the patient comes and asks, I am suffering from COVID. I had COVID during my antenatal period, and now I am having COVID. And this is then the third wave or second wave, whatever wave. The breast milk is the best source of nutrition for infants and protects them against illness, even in COVID situations. Even now we have a lot of guidelines which tells that the COVID transmission of a virus is not through the breast milk. Rather than that, it transmits the antibodies to the baby. So breastfeeding is must even in the pandemic. The mother is suffering from COVID-19 also, corona situations. We have to feed the baby. So the mother should continue breastfeeding. If she thinks that she may be having COVID, or if she is proved with RT-PCR that COVID-19 is positive, she can go for the breastfeeding. Breastfeeding should not be stopped. But what are all the things you should follow? 8 steps of the washing. Before feeding and after when she fed the baby, hand washing. Frequent hand washing is very, very important. That we should counsel the mother. So you can very well feed the baby, but hand washing is very, very important. Sometimes you can even ask them to have the gloves also. So this is the palm to palm between fingers. This, if they are not able to do, at least 2 minutes with the soap, continuously they should do. Hand washing is must before feeding the baby. And if they are having the face mask, they have to have the mask and then feed them, because they have the close contact. When they are going to feed, sometimes they may have sneezing or some cold will be there. So it is better to have the mask and then feed the baby. So hand washing is must, and they should have the face mask and with the baby. Once the baby is fed, they can make the baby lie down at a feet of 6 feet distance. That 6 feet distance should be better. Skin to skin contact is best, but still, once the feeding purpose is over, means you can make the baby to lie down little at a distance of the 6 feet. Then wherever the COVID positive mother is there, means the environmental cleanliness is very, very important. Whatever the table they have used, whatever the cloths they have used, that has to be washed out separately. So routinely clean the surfaces, the table, whatever the soap, using soap and water, tumbler, plates, everything. They can have it separate, and that will be very convenient such that it will not spread to the others. The places also has to be, spray has to be applied with the alcohol and the acetic acid, whatever we are doing. And the face, maintain the physical distance, which I told. Once the feeding is over, it is better to keep the baby 6 feet apart for the baby, and then you can wash your hands and take the baby and feed the baby. Feeding purpose can be done. But the same 8 to 12 times per day, the feeding should be given. Because of COVID-19, whether it is 3rd day or 14th day or 1st day, no need to stop feeding the baby. Breastfeeding is must, and it has to be followed. And the mother, she should not touch the eye, she should not touch the mouth, she should not touch the nose. This is for everyone. The same thing is avoid touching face for the feeding mother also. So this is the purpose. So wash your hands, have mask, and encourage mothers try to avoid touching the face. Mother should wash hands after noticing suppose if she is involuntarily start touching the eye or touching the nose or touching the mouth, means she should wash the hands. That only we mention as frequently wash hands, wash hands. After that, so if the mother have severe illness, COVID-19, sometimes they may be very difficult and they may not be in a situation to feed the baby. In that situations, COVID-19, now normally the COVID-19 is categorized as mild, moderate, severe, home quarantine, hospital admission. In that way, if they are having the severe illness and they are not able to feed the baby, means in that case, you can give the expressed breast milk. In that case only, when the mother is not good and she is having dyspnea and she is not in a position to feed, then you can go with the breast milk. And assistance with the latching baby and support that some nurses can be there, and that nurses can take this breast milk, and she should be having the mask, and she should also have washed the hands, and she can feed the baby with the whatever is given from the mother. And again, the hand washing with water and soap. Expressed breast milk should be fed to the child using a clean cup and spoon. In this, what we can do means, if one attender is there, the mother is in a she is not able to feed, and she gives the expressed feed milk means she can get in the container, and the attender can have the container. From this container, it can be poured into the attender container, such that the virus from the vessel, the virus cannot spread. So it is better. This is the way we can fed by a person, and we have this person who is the attender should not have any signs and the symptoms. And she, if needed, she can also be tested for the COVID, and she should be there for at least 2 weeks or 3 weeks. It is better to have a single person as attender. So this is the way. In some places, you can have even the donor milk. If the mother is admitted in ICU and she is not in a very severe condition, you can have even the donor milk also. So the child under 6 months, the same thing, whatever it is, 6 months or after 6 months with the complementary food is added also. After the 6, if the baby mother has delivered and now she is 7th month and she is having COVID-19 means, again, she can feed the baby. The same thing she can follow. If she is in the mild conditions, wash the hands and have the mask and feed the baby. And if she is in the severe condition means, she can, if she is not able to feed the baby means, express the milk and give to the attender, and this attender can feed the baby with a spoon. So the same thing after 6 months to COVID-19, continue the breastfeeding, whatever be the duration, 6 months, 7th month or 1 year. COVID affected in the first day or 14th day or whatever day. Mild cases, they themselves can feed. Moderate cases where they are not able to feed means they can express and give. If it is in the severe cases, they can go for donor milk. Whatever it is, give with the spoon, cup and spoon feeding is better. Soap, with the soap, they have to wash the hand. And main thing is, if the now I am 6 months, my maybe 6 months, I want to go for the function, no gathering. It is better to avoid the crowding up to 2 years. As long as you feed the baby, normally we advise everyone not to go for the gathering places, that to the public places. So they should not go out. They should be in the house itself. Gathering must be avoided, and they should have a good diet with protein, nuts, fruits, and sprouts. Everything they can have, and plenty of water and plenty of milk. That diet should be rich with the protein. The mother should have a good diet. So avoid this food with low nutritional value and sugar, sweet and high in sugar and salt. This is normal. So these are all some guidelines which I have mentioned now itself. Avoid separations and infantile continue breastfeeding. These are all the guidelines which is given by the many issues. That is, give the mother should have the mask, and breastfeeding is must. If they are going to be hospitalized means, from with the attender, they can give the breastfeed. And infants to mother is, if they are not able to feed means, express the milk and feed with the cup and spoon. So wear a mask. These are all guidelines as which I have mentioned earlier. For the first 6 months, what they should do, and the earlier period, how they, in the mild cases, what they should do, expressing milk in the moderate cases, and the severe cases, they can even go for a donor milk. Do not share equipment for a breast milk expressing. That type in the severe cases where the breast pump is not advisable. So the category wise we can give. So personal hygiene is very, very important. Wash hands often for 20 with soap and water, and the sanitizer 80% ethanol that has to be given to the entire places, and whatever the instruments, the table, what they have used, that has to be sanitized. Cover the mouth and nose with the mask, and wash hands before giving food, feeding the baby. Good meat and eggs. Nowadays you get the COVID diet itself with high protein, meat, sprouts, egg, whatever soups. Surface disinfection is important. That has to be given. Surface disinfection, that is the table they have used with 0.1% sodium hypochlorite and 75% ethanol. Frequent spray is also important. As far as we should see that it should not affecting the baby. Keep the mother and baby together when they feed. If needed, after the feeding, they can keep it at a 6 feet distance. Avoid close contact with anyone who is coming. Always you should not encourage visitors to come to the house. And if at all they come also, you should ask them whether they have suffered from cough or sneezing or fever. So avoid going to the crowd place and avoid gatherings. Do not allow anyone to kiss the infant. Nowadays, all of the patients are very clever. And even the mother and the father, they don't kiss the baby. If they kiss one day, somebody will tell you are kissing, why don't I? So it is better. Nobody is allowed to kiss the infant, such that we can be very, very sure. Do not allow anyone who is ill to visit the baby. Better, no, whoever is taking care of the baby, they can have a COVID test. Only that person can be allowed to be with the baby. Others should not be allowed. Don't allow the visitors. These are all the general guidelines. So the mental health, what happens if the mother is having the COVID-19, generally they are getting depressed. It is not like that. If they are having COVID-19 also, no need to alarm, no need to worry. They can feed and they can be like other normal person. Self-isolation with the baby, you can be in the separate room. That's all. What is that? Baby is going to be with you. After feeding, I personally tell them, after feeding, you keep the baby 6 feet apart. So there is no need for mental alarm. The Foxy Guidelines, we tell, we have the Foxy Guidelines, which tells that even in the COVID-19, we have to give, we can have vaccination, and breastfeeding is must, which I discussed earlier. The same thing is done, told by the BPNI and the Foxy and the WHO. Close contact and early exclusive breastfeeding helps a baby to thrive. All women have the right to safe and positive childbirth experiences, even if the COVID-19, it doesn't mean that only the COVID-19 test is done, the delivery has to be conducted. Nothing is needed nowadays. You can be, even with the COVID-19, they can go for delivery and they can feed the baby and they can have the vaccinations. So this is that last year, April 20 guidelines, which tells if after birth, the mother is asymptomatic, direct breastfeeding. The mother is having cough and fever, dyspnea, mother, you can express the milk and it can be given with the pumped milk. Newborn needs ICU care? Definitely not. If needed, the baby can be tested. Previously, they will test the baby before discharge. Nowadays, it is not at all advised. Consider that baby will be negative and you can have the self-quarantine for 14 days. So the lactating mother, can I have vaccination? With that, we should not have the vaccination. But the real fact is that all the vaccination, whatever baby the vaccine, Covaxin or Covishield, whatever it is, the lactating women also can take. Nowadays, we have the recent guidelines, even the pregnant woman should be vaccinated. So the COVID-19 vaccinations in the breastfeeding is must. They can have. There is no mechanism. You should therefore not stopping breastfeeding, and vaccination should also be not stopped. In fact, rather than we think that virus will spread to the baby, it is not at all like that. The antibodies, if the mother is COVID-19 positive, means the antibodies which is inside the mother's body will go to the baby. Automatically, the baby will get the antibodies. So the number of pregnant women and neonates with COVID-19 is also on the rise. But the antibodies spreading, going to the mother, they have done a study and proved that antibodies in the baby is very good. So feeding the baby should not be stopped. So which I told the study which mentions that antibodies are seen in the breast milk and it is good for the baby. This is the statistics of this. So conclusion is breastfeeding is best. And it is the only feed which is important for the baby to be free from infections and to have the mother bonding. Even in the COVID pandemic, the breastfeeding should be given. It should not be interrupted. Skin to skin contact is must. And as far as possible, the breastfeeding is free from infection, free from respiratory disease, free from diarrhea. So it has to be given. Breastfeed is important for everyone. So if the mother is infected, to avoid the droplet infections, they should have the mask and the steps should be followed. Hand washing is important and mask is very, very important. If the mother is too ill in a situation where they are not able to feed the baby, you can give the express milk. If needed, you can go with the pump. Otherwise, finally, if they are in the ICU, you can go with the donor milk. But as far as possible, try to give the breast milk alone for the first 6 months, whether it is COVID or not. So finally, this is the word we should follow in this pandemic situation. You should follow the women. Wash hands frequently. Obey social distancing. Mask when you feed the baby. Eat well with a high protein diet. No gathering. If you follow this women, the baby will have the breastfeed and you will not spread this disease to anyone. Thank you. Once again, I thank the Shield.
Thank you, ma'am. Thank you very much for that wonderful and detailed presentation, ma'am. Ma'am, let me wait for 1 or 2 minutes for the participants to post their queries, ma'am. If there is any queries, then I will read out for you, ma'am.
Yes, Stalin. Nowadays, everyone will be very, very experienced with COVID.
Yes, ma'am. We have 2 questions, ma'am. The
Yes.
first question is, what is the effect of COVID-19 medications, immunomodulators on breastfeeding, madam?
Immunomodulators, that only I told. If the mother is having mild, that immunomodulators, everything, we categorize the COVID as mild, moderate, severe. Depending on that only, the immunomodulators, everything, whatever the drug is given, the antibodies will be through the breast milk. So what now, if the mother is in a situation to able to feed the baby, means no need to bother about the drugs. They can be given. That's all. If she is not in a position to feed the baby, means, as I told, expressed milk can be given. If it is in the severe condition, then only whatever the drugs categorized will be there. In that situation, if the mother is admitted in ICU, they may not be able to feed the baby. There we can go with the donor milk, or that situation is very, very rare. So immunomodulators, whatever it is not going to affect the baby.
Thank you, ma'am.
Next question.
And next question is, sometimes even after giving good nutrition, there will be not enough milk secretions. So how to enhance a breast milk in the woman, ma'am?
Yes, that is always this problem is going on for many decades. I'm eating very well. I have Complan, I have cashew nut, but still the milk is. There is no category that milk is not coming. As long as the baby is sucking, the breast milk will come. It is only the psychology. If you are keep the mind free and feed the baby, that is the only thing I will advise. Other than that, nothing. Milk will be sufficient. Even the thin, whoever is not able to not getting the food for 3 times during the antenatal period, that person will also have the sufficient milk. As long as the baby is sucking, the breast milk will be sufficient for the baby. Our psychology should be changed.
Yes, ma'am. Ma'am, I don't have any other questions in the chat box, ma'am. So there are some good comments that the session is excellent and useful for them.
Thank you.
Thank you, ma'am. Thank you very much for accepting our invitation and for being with us today, ma'am. Thank you for your time, and I would like to
final advice to delegates and everyone is try to live with, cope up with the COVID. That's all. There is no point in getting afraid of COVID. Thank you, Dr. Stalin. Thank you for the delegates.
Thank you, ma'am. Thank you very much.
Thank you.
I'm ending the webinar, ma'am.
I am leaving. Thank you, sir.